Before you begin your patient evaluation, it's very important to become familiar with the Townsend order form. There are some key things that we need to know in order to broaden our clinical perspective of the patient that you're working with. Some of the key things that we need to be aware of is the patient's height and weight, and an intimate understanding of the type of shoe that the patient will be wearing. In addition to that, we want to gain an understanding of the range of motion at the level of the ankle and the knee. We also want to perform a basic manual muscle test. We want to gain key perspectives into the types of muscle groups that are weak within the patient. From there, we also want to expand into our biomechanical objectives. We want to gain an intimate understanding of the level of support and biomechanical function we want to achieve with this device. In addition to that, we want to gain an intimate understanding of the degree of tone or spasticity that the patient may exhibit. For example, some patients might be flaccid, whereas others are very firm in their deformity or have a high degree of tone. All this information together will help us understand exactly the type of patient you're dealing with and then allow us to achieve the proper biomechanical objectives of the brace through determining the type of stiffness the brace needs for your patient. We want to take into account the cast and the alignment position. We want to also consider the clinical indications and our biomechanical objectives. The amalgamation of all this information allows us to precisely understand the exact category of stiffness you and your patient need. When you're evaluating the patient's shoe, it's important to measure the patient's actual heel height. The way in which you can do that is start by removing the insole from the shoe, take the calipers and measure the heel height, then identify the metatarsal break at the shoe, take a measurement there. Once you have your metatarsal height determined, you want to subtract the metatarsal height from the heel height to determine the proper footplate size. When casting for a custom AFO, Townsend Design wants to make it perfectly clear that it is very important to use a footplate. Now, without the footplate, everything would be relatively flat, and that would negatively impact how the brace fits within the shoe. To avoid that, utilize a footplate, whether it's something that you purchase or something that you make in-house.
Once you've completed your clinical assessment of the patient, we're now going to be ready to take the cast. Using the cast, as we've already told you, it's imperative that we use a casting block with a predetermined heel height to match the patient's shoe and biomechanical objectives of the brace. So what we're going to show you now is how to properly use a casting block. Once we've completed our clinical evaluation and we've measured the shoe, now we're prepared to go ahead and cast the patient. It's essential to go ahead and use the exact number for the heel height to place on your casting block. You also need to ensure that we have added the toe extension board as well. We're going to place the patient on the casting block, ensuring that we don't get too close to the metal pegs. We're going to make sure the patient is centered within the casting block itself, and we need to work on our toe extension. Now, the toe extension, just like when you measured, we're going to use the metatarsal break. So the edge of the toe ramp will slide like so till we get center metatarsal head. Now, we've addressed heel pitch and we've addressed toe ramp. Now we need to get our 7 degrees of tibial inclination to make sure that sagittally we're aligned with the knee over the ankle. So we're going to go ahead and slide the black, and we are aligned. The last thing we're going to do is just double check that our toe out is accurate as well. This is a grid board that Townsend Design created specifically for the custom spiral AFO. We do have a center line, which will give us a tibia vertical line, and we also have not only the grids on posterior, but we have the grids at the foot plate as well. This will help us to determine deviations in the cast for a good cast or a failed cast, which would be a bad cast. And we're going to show you examples of proper aligned cast, and we're all going to show you examples of a poorly aligned cast. We're going to give you examples of proper alignment with this shot. You can tell that we have an alignment line which will closely mimic the alignment grid that's in the back. So this is going to be center tibia. The patient, when casted, should have had knee centered over ankle. And now we're checking coronal alignment of the hind foot, trying to determine if the patient's hind foot alignment is appropriate. As you can see, we do have total contact at the heel from medial border to lateral border, and the plumb line runs center up the Achilles tendon. So this is a properly aligned cast. We're going to rotate around and we're going to look at the forefoot. So as we look at the forefoot, again, the strap is simulating weight bearing. The cast is nice and rigid, so there's no deformities happening here. And we do have full contact on the fifth met. And then we're also going to check the first met as well and make sure that we have good contact here. So now we know that the hind foot is aligned correct, the forefoot has great alignment, and then the last thing that we're going to check is sagittal alignment and make sure that the tibia has a 7-degree inclination based off of the heel wedge. So we'll just slide this over and you're going to be able to see that we're at the center malleoli, we're at center of the calf, so this is properly aligned in the sagittal plane as well. In this negative model, we're going to demonstrate bad sagittal alignment. Unfortunately, this alignment would be catastrophic to the function of the vector device. You can tell that the hind foot is correct, and when we spin, we're going to look at the forefoot. There is a gap here, but there's also a gap on the first as well, and those gaps are actually even. So we know that the forefoot looks good, the hind foot looks good, but if I slide this over sagittally, you can tell that this cast is in at least 15 or 20 degrees of plantar grade, which is unfortunately going to be a failed cast. That amount of correction would have an impact on the midfoot and hind foot alignment, so therefore we would ask for a recast to make sure that it accurately reflects what we're trying to do. This is going to be another example of a poorly aligned cast. In this particular cast, we're going to demonstrate that the sagittal alignment is actually pretty good, but the hind foot alignment and the forefoot alignment is not good. So looking at the plumb line, you can tell that the hind foot is in a significant amount of inversion, which is not indicative of what is on the order form. When we spin around, we'll take a look at the forefoot. We do have contact with the first met, which is good, but when we spin around and look at the fifth met, there's a significant gap, which means this forefoot is in a significant amount of pronation, and that's going to require a major correction. So this would be an example of a cast that we would have to fail again and then ask for a recast. Now we're going to present you with a set of bilateral casts that are not symmetrical to each other. And according to this work order, these casts should be symmetrical. So I'm going to, without using the alignment board or the grid, just give you simple examples of the importance of left matching right. Using prosthetic alignment principles, we want to ensure that the angulation and the stiffness of the devices are accurate. So the forefoot in this particular cast is adducted, so we have a medial drift. If we flip, the hind foot is somewhat neutral, so that's good. And then we also are dorsiflex, so we know that we have a negative heel height at this point. So this doesn't accurately reflect the heel height that was asked in the device. When we grab the left foot is not symmetrical to the right foot. So we have, if we hold it in this direction, there's a significant amount of toe extension, which is going to present a challenge in modification. We do have the forefoot supination, but if you look there, we've now incurred a little bit of hind foot verum, so that's going to be an issue as well. And this cast is also dorsiflex as well. So A, these casts are not symmetrical. B, in of their own, do not match the work order, so we would have to make a phone call on this and possibly ask for a new cast.
Prior to fitting your patient, you want to make sure that the strut is perpendicular in the sagittal plane. So you want to take a look and make sure it is positioned properly within the shoe. And then you also want to check in the coronal plane to make sure that the strut is perpendicular as well.
We really look forward to processing your orders and achieving outstanding outcomes for every one of your patients. Thank you.